Well, good morning. I'm Bob Ravenscroft, a Vice President here at Bryan Health. I would like to welcome our valued members of the media to this press briefing, and for those of you following along on Facebook Live. The media is not physically present at this briefing. However, we are conducting via teleconferencing, so they will have the ability to ask questions of our team via chat. We're going to conduct these regular briefings in this manner to mitigate the spread of COVID-19. We want to protect our media, we want to protect our patients, and most of all, we also want to protect the 5,000 members of our team that will be on the front lines of this as long as is required. After providing you with some information and some numbers, the briefing will include remarks from Russ, the Chief Executive Officer of Bryan Health, Dr. John Trapp, a pulmonologist here in the community and the Vice President of Medical Affairs, Lisa Vail, our Chief Nursing Officer, and John Woodrich, the Chief Executive Officer of Bryan Medical Center. I want to give you an update on the website and social media. It's an effective tool for you to all access. We believe it's helpful right now. We have had over 15,000 Facebook engagements. This is not just people who have seen it, it's been people who have engaged with our site, so it's valuable to get information out that way. I would like to direct everyone to bryanhealth.org for our dedicated COVID-19 page. So far, over 7,900 views have viewed our page. You'll find information about Bryan services and also links to many other credible and vetted pieces of information and sources. Our 24/7 hotline, which is staffed by a nurse, is 402-481-0500. To date, this hotline, staffed by nurses, has received over 300 calls. People calling this receive a consultation and then direction to the next level of care based on the findings of that call. Again, the number is 402-481-0500. The next service to give you some information on, our Bryan Easy Visit, which was stood up, can be accessed directly at bryanhealth.zipnosis.com. That's Bryan Health, ZIPNOSIS.com, or you can get there from our webpage. Since implementing this online questionnaire, over 3,500 people have completed it. Based on the algorithm, 587 were advanced to the next step of screening, and 206 of them used the COVID-19 code. That is important because using that code, if you get to that step, will waive all fees for the visit. The results of this easy visit screening or test questionnaire for upper respiratory illness will act as a physician referral if an in-person evaluation is needed. Our Bryan LifePoint campus with our urgent care, we implemented the walk-up clinic. There is a segregated entrance for normal urgent care needs and one for upper respiratory illness. And as of this morning, it has exceeded over 200 patients since opening on Friday. Testing, it's a hot topic. To date, Bryan has tested 21 people for COVID-19. 18 have come back negative. 3 are pending. It's important to note there are other testings going on in the community, and the Department of Health and Human Services are updating those numbers regularly. With that, I'm going to ask Russ Gronewold to come to the stage. At the conclusion of Russ, John, Dr. Trapp, and Lisa's remarks, we will respond to the media's questions that are coming in via chat. Russ.
Good morning. There are 5 topics that I want to address in short order today. The first one is this. I want to make sure that you know that Bryan is prepared. We've been working on this since January 16th when the first case came out, and working with public agencies and others to figure out what this might mean for our community. Recently, we stood up our Emergency Incident Command Center. We are now 24/7 on that, so we're around the clock looking at this and adapting our pandemic plan to the most current situation and the most current guidelines. This isn't something new. We've had a pandemic plan. We are now just taking that plan, acting upon it, and then adapting it to our current scenario. The second thing is we are not doing this in isolation. We've had a tremendous amount of cooperation from the governor's office, the mayor's office, public health, CHI, other providers around the community and outlying in the greater Nebraska area. So we really are all working together and have regular consultations with them to make sure that we're coordinating our efforts. It's been it's really been a good sense of what we're doing collectively as an organization and as a community. The third is we have stood up some new services. Bob mentioned several of those already. He mentioned the nurse hotline, which has received hundreds of calls, the urgent care, the Easy Visit that's received thousands of visits online, as well as the walk-in upper respiratory clinic. We also have had telemedicine very active over the last days. In fact, in the last 4 days, we've connected 75 physicians to virtual waiting rooms and virtual visits for their patients. So we're going to continue to do that as requests come in for that. But we think that's another way that we can provide health care to those folks who need to stay at home and lessen the exposure throughout the community. We're also providing a lot of telemedicine to the over 60 hospitals that we have connected around the state. Finally, I know a lot of folks around this area in terms of our additional services are very curious about a drive-through clinic. We're still working on that. But I'll talk a little bit more about testing really being at a premium right now, and so we're unable to stand it up as we had originally planned. We are looking at redoing our drive-through clinic as we receive more information about the best way to do that, as well as conserve the appropriate supplies at this time. Gosh, the fourth area is just I want to publicly acknowledge the team at Bryan. What a tremendous amount of work our team is doing, and this is a very fluid and uncertain situation. Rather than running away from that, our team has run toward it. I'll just give you two very simple examples. There are many others I could mention. But for example, when we had to implement visitor restrictions in a very rapid fashion, we asked for volunteers from our current staff to fill those slots that we were going to have at both campuses. Within 2 hours, we had volunteers filling slots, all the slots, for 3 weeks out. Just a tremendous response from our own staff. As well as when we found out that Lincoln Public Schools and Norris Public Schools would be closing, we immediately had challenges regarding child care needs, and within 24 hours we were able to free up 120 child care spots so that we could have folks helping take care of our staff's children so they could continue to work here. I just want to acknowledge also, I know there are many of you in the community, whether it's family or friends, who have rallied around that staff. Thank you for doing that, for your encouragement and your assistance to them so they can continue to provide care here at Bryan. Finally, the message that I have to the community right now, you've probably heard nationally as well as locally, testing supplies and other supplies regarding specific to COVID-19 are at a premium. They have not hampered our ability to take care of current patients. We have been able to do that and handle all of those needs without any slips at all. However, they are at a premium, and so if we wish we had more supplies, we don't at this time. So since we don't have as many as we would like, we want to make sure that we're doing everything we can to valuably use those supplies. So here's what you as a community can do. Number one, we really want you to stay calm. Most of you are not going to get COVID-19. And if you get COVID-19, less than 20% of you are going to likely require any hospital care. Most of you, over 80% of you, will recover fine at home. And so the most important part is just to stay calm through all of this so we can get you to the right level of care. Second, we really encourage you to follow the guidelines of the public officials, the governor, the mayor, and others around social distancing and certain practices around gatherings. This is really important so, again, we can prevent the overload of the system by keeping the incidence of COVID-19 as low as possible. And finally, if you do have those healthcare needs, I want you to consider starting with the non-hospital services. Go to the nurse hotline, go to Easy Visit. One of those two places would be a great place to start. And then they will direct you on where you should go next in order to utilize the system and get the most advice and direction in a most expeditious fashion. Thanks for helping out in that.
Good morning, everyone. My name is Lisa Vail. I'm the Vice President of Patient Care Services and Chief Nursing Officer here at Bryan Medical Center. I'm going to just give you an update on our visitation screening process that we implemented on Monday. It's going very well. Russ already spoke about the great response of our staff to make sure that we could get this stood up. But I want to just give you a few pointers and reminders about how this is working. We will be asking all individuals who access the organization from any of our doors some screening questions about their health. So we will be asking about, do you have a fever? Do you have a cough? Do you have shortness of breath or any breathing problems? If you are here to visit a patient, you will be asked to go home until you are well. If you are here to see a provider in one of the medical offices, you will be put in a mask and you will be sent to your appointment that way. It's really, really important that if you are not feeling well in any way, that you not come into the hospital. We are also restricting the number of visitors that come to see our patients. That is being restricted to 2 immediate family members only. And it should be the same 2 individuals that visit that patient throughout the entire course of the hospitalization. We ask that you use other types of technology to connect patient and family members when they can't physically be together, so you can keep current with what's going on with your loved one in the hospital, but also use those 2 immediate family members to be that liaison and that connectivity for you. It really is to help keep your loved ones safe. We don't want to bring any potential issues or illnesses, whether it's influenza or other things, from the community into our patients or our healthcare workers. This is going to be a long journey for us as we continue to work through this, and so the health and safety of everyone is very, very important. Thank you.
Well, good morning. My name is John Trapp. I'm Vice President for Medical Affairs. I'm also a pulmonologist and critical care physician. I will say a tremendous amount of work has been done. So proud of all of my colleagues within the medical profession here in Lincoln, Nebraska, and on what they've been doing. Almost daily I get texts or calls talking about the physicians' compassion for our patients, asking what they can do to help, taking learnings from their colleagues in other cities that have been hit hard by the COVID-19 pandemic, bringing those learnings to Lincoln so we can best prepare for our patients. Surgeons asking me, how do I minimize use? How do I reduce risk to some of my older patients who may be at higher risk for COVID-19? Some are electing to cancel their elective surgeries, tell you to stay home, be safe, not come into the hospital for routine care. But if you need urgent care, we're here. We're going to take care of you. A number of the physician leaders from a number of different groups have been involved in our central command, speaking up, making sure voices are heard, helping to coordinate care, thinking ahead, preparing. We anticipate we know what's coming, but we won't completely realize it until it's here. So we're going to continue to prepare the best that we can of preserving supplies, thinking appropriately about patients, scheduling, working together as a team. I want to call out a couple of our physician leaders. Through our emergency department, Dr. Ed Malinik, tremendous strides in preparation in the emergency department, preparing, educating his providers, making sure they're safe, making sure patients are safe, dividing up areas where respiratory patients can be assessed safely, expanding for surge capacity. So if all of a sudden there's a surge in number of patients that need emergency department services, that we have that capacity to overflow into. Just this morning, talking about these types of concepts. I want to call out our hospitalist team, Dr. Alyssa Clough, preparing our hospitalists with education, safety, just information on how to better care for patients. How do we identify these patients, isolate these patients, and yet protect the medical staff the best that we can. Dr. Bill Johnson this morning having a critical care meeting, educating our intensivists with regard to what might come if patients require more intensive care services. How do we prepare? How do we provide the best of care? What are some things we should do and shouldn't do? So bringing these learnings here to Lincoln, Nebraska. We also have developed a multidisciplinary team of multiple key service lines that will provide care for the vast majority of these patients who are hospitalized. We have started to meet daily to share learnings, discuss opportunities, things that we need to know to better care for patients. So again, tremendous amounts of collaboration going on through multiple teams of physicians. I've been asked to comment on what's the difference between screening and testing. Screening is where we look at an individual and we ask questions. We ask, do you have fever? Do you have cough? Do you have other respiratory symptoms? Have you had high-risk travel that may put you at risk for COVID-19? Have you had contacts with other individuals previously diagnosed with COVID-19? If you come in with those respiratory symptoms, we may screen for other types of disorders. We're still having influenza here in the community. We may look for other respiratory pathogens with some certain nasal swabs or nasal testing that we can do. This is screening. If we screen and we find an alternate diagnosis, at this point in time, we're recommending treatment, if appropriate, for disorders like influenza, and we're asking you to go home and stay quarantined for a period of time. If these tests are negative and you are relatively well and able to be managed as an outpatient, we're recommending the same. Stay home, isolate yourself, don't expose yourself to other people to minimize any exposure of any type of viral illness. On the other hand, if you have symptoms, we may do additional chest imaging. We may request COVID-19 testing, and you may require hospitalization. We want to identify those patients and provide the best of care for those patients. One of the challenges truly has been the limited access to COVID-19 testing. Right now, we are not able to test for that at Bryan Medical Center, but we send these tests out to the state lab. We have done 21 tests so far. We would like to see more tests. We'd like to offer that to more people in the community, but right now, with limitation in reagents, that is a limitation right now. Again, if you're well, we're going to recommend outpatient management. Most patients, the vast majority, will get well over time. For those who need hospitalization, those are more likely to be prioritized for additional testing. We hope to have more testing in the next 3 to 4 weeks. I spoke to one of our laboratory directors. We are working at Bryan to make sure that we can do this test here on site in the next few weeks. We'll keep you posted as we know that information. Commercial labs have also been overwhelmed by the number of testing requests throughout the country. Limited resources with regard to those labs. So again, we want to take great care of patients. We want to screen the best that we can. We want to test where appropriate and work together as a team to provide the best of care. So thank you.
So we've stood up another 8-bay treatment area for those upper respiratory patients. So you will see it signed appropriately down there, so there shouldn't be any confusion in regards to which door you should come into. We are also exploring other locations throughout the community as potential sites for people to go to, because we know geographically how big Lincoln is. We will share that information with you as that becomes available. I did want to comment a little bit on elective surgeries. We are still doing elective surgeries, but this could change by the day. We're looking again at the amount of supplies we have and what that means of should we postpone some of those. Your own physician may postpone your elective surgery, and that is the right of that physician if they feel that that's appropriate to do. Did want to just let people know, business for everything else, we're still taking care of all the other folks that come in for other disease processes or illnesses. So we also have to stay very focused that there is the normal activities that happen throughout the community, and we want you to know that we're there to service you for that. As was mentioned earlier, the drive-up capability, that's just another way of keeping people isolated. But as we're feeling more comfortable, or as we get more comfortable of getting additional supplies, there's a potential of standing that up. But right now, we have to be conservative. We're looking at what's happened in other parts of the world, and we just want to make sure that if we can control this, we're better off as a community. And once again, we just express this to all of you. Listen to what the public officials are doing and are commenting to you to do, and please, if you can stay isolated and separated from others, that's the best thing that we can do to avoid the spread of this. With that, we would open this up for questions through the chat line. You know, I think part of this is what you see in the screening. So as an individual, what you should do is go ahead and utilize the easy visit, because as people are feeling sick, once again, we're looking at that screening process. They may just have influenza, or they may have a common cold. One of the couple big signs you're looking for in this is people running a fever and having a shortness of breath. So I think when people look at respiratory conditions, don't just automatically assume it's COVID. That's why we want to go through the screening process, and that's what we would recommend that people do. Yeah, oftentimes on the elective surgeries, you'll find out a lot of those are an outpatient type of surgery. And when we're looking at supplies, we're continuing to monitor it. We do want to be very careful in relationship to monitoring the surge. I believe that if we had a positive test occur here in Lancaster County, it would definitely change what's happening. But at this point in time, we feel that it's okay for people to do elective surgeries. But again, that depends on the individual. It depends on their doctor. But I will tell you, we will probably change that depending on our availability of supplies as time goes on. But we're all monitoring that very closely.
Although we're licensed for over 600 beds, we probably have about 525 that are operational on any given day. We are continuing to look at new areas of the hospital, and we do have plans for a couple of new units opening up here yet this year. And that's a 17-bed unit and another 11-bed unit. But we also, if we do cancel elective surgeries or have other things that happen, we have many other places where we can provide care if there is a surge. So we could be using some of our outpatient procedural areas, the specialty clinic, and so on. So we have quite the capacity to deal with any surge issues.
Easy Visit is an offering that has been out there for quite some time. It's an online diagnosis deal that goes through an algorithm, and it's typically been for routine care things, urinary tract infections and other common things. There's about 18 things. What our team did under the leadership of Bryan Telemedicine and Dr. Brian Bossert was build something specifically for COVID-19. It's a questionnaire that will kind of take you through what are the next and most appropriate paths. But it's an online diagnosis tool that's used throughout the Bryan system and frankly throughout the other parts of the country. We have just built a special COVID-19 questionnaire to fold into that screening process.
The simple answer is yes. In fact, there may be people within the community that have this illness that have mild symptoms. Again, the symptoms may be mild enough to just be a low-grade temperature, low-grade fever, cough, and they may be walking through the community and feeling relatively well, may not even feel the urge to seek medical attention. Yes, they could have this disorder. Are people being evaluated through our emergency departments that potentially could have the disorder? Again, we try to screen those. We look for the highest risk. If they are not approved for testing by the state lab, then yes, they could be sent home and could be positive, so that is possible. Again, the recommendation for almost all of these patients are isolation, and for patients with higher risk, it's for 14 days.
This morning, for example, we had a midnight census of 440-ish patients, so we easily have close to 100 operational overnight inpatient beds available today. But as I said, we have many outpatient areas, and I bet we probably have another 75 beds that we could use for patients if we needed to in a surge situation.